integrative doctor. The question is always, what is integrative medicine? What is regular medicine? What is integrative medicine? Well, there's a different way of thinking in conventional medicine and integrative medicine. Conventional medicine thinks very linear. Now, we make diagnosis at the end point. And when you have a blocked artery, we call it heart disease. If you have a tumor, we call it cancer. So you gotta make a diagnosis at the end, and often the diagnoses are very localized. Now, when you have a problem here, you go to the lung doctor, here you go to the neurologist, here you go to the orthopedist, here the gastroenterologist. And then the family doctor tries to bring this all together. And so often the treatments and the diagnoses are very split up. The other thing that when we look at causality or what causes things in conventional medicine, we're always looking for the cause. And many times we can't find the cause. And so we've created a lot of diagnoses that describe something that we really don't know what causes it. Like, of course, the things like autoimmune disease, when you have something like lupus or rheumatoid arthritis, you know, we say, oh, you have rheumatoid arthritis, you have lupus, and then they say, well, what caused it? We don't know what caused it. And then there's many illnesses where we even can't find anything specifically wrong on the tests we do, and we call that functional disorders, and we have names for that, like chronic fatigue syndrome, fibromyalgia, irritable bowel, migraine headaches, PMS. These are all called functional disorders. And sometimes when we give it a name, yeah, we give it a name that therefore we know what it is. And you know, in one way, when we talk about Lyme disease, it looks like, oh, we know what that is. You got a bug, and the bug is causing problems. And in my experience, it just doesn't work that way. And that's why it's such a difficult illness to treat and to figure out, you know, what's really wrong with people and how to make it better. So it's a little disclaimer. So that, you know, so in the integrative medicine, we do things a little different. First, we try to look at the whole. We have more of a systems approach. And I always say in integrative medicine, we try to look at your body the way you deal with your marriage and your business and raise your kids. You look at many factors and you take individuality into account. In regular medicine, most treatments are based on statistics. And if a doctor makes any decision to do something separate, then he said, well, he's just using it off-label or he's just trying something. But the body is very complex. You know, there's so many factors play a role in illness, and many times we have to take a number of these into account, else we can't solve problems. And I find that causality in chronic illness is usually multifactorial. There are many things that contribute to your illness. You know, and that's what you see sometimes. People have Lyme disease, they have chronic Lyme disease, and then, you know, your neighbor says, well, did you not get 3 weeks of doxy? I have an uncle who was really sick, and he was even admitted to the hospital, and he got 3 weeks of doxy, and he's better. And you're not. So they poorly, the bug did something, they killed the bug, and the person got better. And so the question is, well, why does this one person get better, and another person doesn't get better? That's just a question to ask. And in my experience is that in general, you know, when you deal with chronic illness, we deal with multifactoriality. There are many things that contribute or may have set you up to become chronic ill. And Lyme disease or whatever other bugs may be one of those things. And on top of that, what I find working with a lot of chronic ill people is that one person is not like the other. You have to take individuality into it. And that's something we have a hard time with in conventional medicine too, because, you know, when you help somebody with a specific thing and you tell another doctor, well, this person had that and I did this and the person got better, from a scientific standard of view, they say, well, it's just the cases. And that's the end of it. And we can't really pay attention to it. And they said maybe coincidental or placebo. So this is test a little bit, and so again, the linear approach was in the systems approach. That's what you said. I actually have to dig a patient in whose family doctor said exactly that.
Wow.
She said, I don't believe in chronic Lyme disease, so you're fine. That's what, I said, wow, that's like the cartoon. I pulled the cartoon up and said, yes, that's my family doctor said that.
Wow.
And then this is a Dutch cartoon character that I grew up with. His name is Ollie B. Baum, and he was a little bit of a bigoted, simple bear, but he was a gentleman. And he had a statement that said, what I don't understand doesn't exist. So, many of people that have had, or maybe even many of you, you know, before you end up with a doctor like me, you often have seen many, many doctors. You know, and there's a rheumatologist you're joining, see an infectious disease specialist, because you ask whether you have Lyme, and the family doctor doesn't know what to do, and he says, well, why don't you go see the infectious disease specialist? And then the infectious disease specialist says, no, you don't have Lyme, or you had Lyme and it's treated, the bug should be dead. Or sometimes, even though you had a positive test, says, I don't think it was Lyme. You know, you see the orthopedists and the neurologists, because you get all these fuzzy, vague neurologic symptoms. Fuzzy numbness, tingling, brain fog, shooting pains, you know, bizarre symptoms that actually, to the neurologist, often don't make any sense. A couple of years ago, I was at a conference in Hershey, and there was a neurologist from near Reading, and his wife had gotten into Lyme, and he kind of got a little interested, and he said, whenever I see people that have neurological symptoms that don't make sense to me, because, you know, neurologists always find where the lesion is. They see that as an electrical circuit, and when you have a certain problem, you know, when I have numbness here, then it's the ulnar nerve, and if I have it here, it's the radial nerve. You know, that's how they diagnose. But when it doesn't make any sense, he said, I suggest to people who have Lyme, and I haven't been wrong a single time. Bizarre stuff happens, and I, you know, try to have an explanation for that. You know, you see the gastroenterologist. It's actually interesting that tick-borne illness can affect the digestive tract a lot. They found DNA of Lyme in the biopsies of teenagers. There's a doctor out in New Jersey, Dr. Freed, who did a whole series of that. You know, a lot of psychiatric and psychological symptoms. People have anxiety, depression, you know, odd symptoms. Some even people can get half psychotic. Some years ago, there was a quarterback from one of the Atlanta, in Georgia universities, who was found naked walking on the street, and it turned out he had Lyme disease. I think Chris Christopherson recently he was diagnosed with dementia, and it turned out he had Lyme disease. He got treated, and his dementia got better. You know, it's very interesting. So a lot of psychological, psychiatric, and it's very difficult. You know, when you end up with your doctor and you have all these fuzzy, vague symptoms, and you're anxious, and then you have been reading online, and your doctor loves it when you have been reading online and you bring in things. And then, you know, he doesn't know what to do. So many people actually end up with a psychologist at the last step. And then your primary care physician, you see the chiropractor, the acupuncturist, the cardiologist. Many people get palpitations and skip heartbeat and dizziness and all kinds of stuff. So that is often, people have seen many of these doctors, and, you know, it's hard to do because they don't find any pathology. In a sense, we're trained to find pathology. Where is the lesion? Where is the tumor? Where is the abnormal test? And you get all these, you know, many people end up having all these tests. Endless chem panels in CBC. People come in with a couple of Lyme tests that are negative. You know, autoimmune panels, MRIs and CAT scans of the head. You know, if you have big pickled joints, they do x-rays. The nerve conduction studies, painful study. Many people with numbness and things, they get nerve conduction studies. you know, and then you see cartilage testing, all kind of various things, and often they don't show much. And people end up with all these symptoms, and they nothing really shows. So why is this Lyme so different? You know, what is it about that? Well, you know, the first is that the symptoms are not always classical. We've been taught, oh, you got a tick bite, and then you got a bullseye rash, and then you get joint pains. They sometimes can travel around. And if you have bad luck, it goes to your brain or to your heart, but that's about it. And then you have a certain standard wave that the diagnosis get made, and if you don't fit it, then you don't have Lyme. But Lyme disease can cause an enormous amount of symptoms. And in a little later slide, I have a whole list of those. The second one is the testing is not very good. Yeah, and we go into that a little bit. Many times Lyme doesn't come by itself. You know, ticks carry a lot of bugs, and we'll talk about that. And then, you know, the fourth one is that the standard course of antibiotic often doesn't cure the thing. But when doctors feel that it should cure the thing, then they stop there, and so when you're still sick, you're supposed to have something else. And then, of course, the last one is that a lot of it has to do with your individual immune system. Like, what is it? Why am I not getting over this and my uncle did? Yeah? So, tons of symptoms. Probably many of you have looked up online, and there's all these lists. You know, I used to have a questionnaire that I have people fill out with 2 pages of symptoms. And they all vary from psychological, neurological, gastrointestinal, motor symptoms, insomnia, it goes on and on, blurry vision, seeing specks in your vision, ringing in the ear, you know, you can't remember things, multitasking is difficult, all these kind of things. And, you know, many people, they look at that when they have sometimes 2/3 of the symptoms they have to cross off. And of course, when you go to the doctor, you know, we regular physicians were trained to look at just 8 things. So when you come in with 5 symptoms that are some related to your head and some to your stomach, he doesn't have time to look at that. And of course, when he starts pursuing these individual symptoms, it's not going to lead anywhere. He does some tests if you're pushy enough, or if he has a suspicion, or he wants to cover himself up. You know, it's like, what God forbid the person has a brain tumor and it misses, so everybody gets MRIs of the head because you can't think straight and you have headaches. And so that is really, the symptoms can be so expansive that it is very difficult for any primary care physician to even try to dig this out, you know, especially when you have only 10 minutes or 15 minutes. The testing. Yeah, the standard test sequence for Lyme disease is that when you go to the doctor and he either wants to check whether you have Lyme disease, or you say, I think I have Lyme disease, he does first an ELISA test. And when the ELISA test is positive, he does a test called the Western blot. Now the problem is that the ELISA test is not very reliable. Yeah, these are a few papers that the specificity of the combination of these 2 tests, if you have both of them positive, the likelihood to get Lyme is about 100%. Great. But when they're not positive, yeah, there's still a 40-some% chance that you could have Lyme anyhow, because the sensitivity is not very good. So it's not very good screening testing. I mean, if they would have the same kind of test for breast cancer, it'd be a disaster. You know, that if you have a positive mammogram, you know you have cancer, but if it's negative, you still could have 44% chance you have breast cancer. Can you imagine that? That would be really very difficult. So that is a really big problem. On top of that, the testing with one lab is not like the other. Labs just vary. I mean, sometimes you repeat a test a couple of times with different labs, and different things show up. And then on top of that comes sometimes how you interpret the test. But 10 years ago, I was at the Lyme conference here in Philadelphia, and one of the speakers was a physician from the Netherlands. I'm from the Netherlands. I went to medical school there. And they have Lyme there too. And he was a research physician, and what he did, he contacted all the labs in the Netherlands that do Lyme testing, and he asked them to send the kits they're using for both the ELISA and the Western blot. And it turned out that he was sent for the ELISA test kits from 20 different manufacturers that these various labs use. Go ahead. That's okay. And for the Western blot, he got kits from 12 different manufacturers. And he had blood stored at the university lab of people who had bullseye rashes. Everybody agrees they have Lyme. And he used the same blood on all these kits. And the only thing I remember, he had this big Excel spreadsheet, and he said, well, I wouldn't want my doctor to use that lab to see that blood. Great variety. The same blood on the same type test, but from different manufacturers. So that's, and then there's particular criteria. I don't want to spend too much time on that. The testing is not bad, it's not great, and you don't want to depend the diagnosis of Lyme disease only on the blood test. You know, in the end, under your Lyme test, often it says that Lyme disease should not be determined only on this test, it's also a clinical diagnosis. But that often doesn't happen. So testing is helpful, it's not conclusive. In the end, it's a clinical diagnosis. Then there's other bugs. You know, ticks carry other bacteria. Babesia, which is a malaria-like parasite, Ehrlichia, Anaplasma, Bartonella, Mycoplasma, all kind of, you know, ticks are dirty critters. And many people are co-infected. And many times doctors don't test for it, and the testing for that is equally not that great. So many times, you try various labs, and then you know, sometimes one lab picks something up, and in the end, I always look, does it fit with the symptom? Yeah. When I have a person, I treat them for Lyme, and they say, well, I wonder whether my teenager had it because he had so many tick bites, and I say, is your teenager sick? Do they have any symptoms? No, they don't. I say, I don't want to test because what are you going to do with that? You get a person who feels healthy, and then you do a test and something shows up. Where do you begin? Where do you end the treatment? It's just not very practical. This was one paper where they looked at the people with Lyme disease had various other infections. 32% in that particular had Babesia, and then there's Bartonella, Ehrlichia, etc. And these bugs can just present with different symptoms. You know, some of them are, you know, like Babesia often causes headaches and drenching sweats. People come and they say, I have drenching sweats every day. Headaches, that often points out to Babesia, sometimes Bartonella. One strange thing about Bartonella is that often people have pain in the bottom of their feet, especially when they wake up in the morning. They get up in the morning and their feet hurt, and then when they start walking, the pain goes away. And often people have odd rashes, they look like stretch marks. You know, and people say, oh no, I have stretch marks, but I've seen skinny, you know, 12-year-old boys with marks that look like stretch marks.
A question, how many of those would be cured or treated with the 21-day typical month-effective?
Well, many of them don't. Maybe the Ehrlichia and Anaplasma, but again, you know, some people get better. I always tell people that some people get better with Lyme by just looking at the antibiotic chart. Because especially at that particular dose that doctors give, 100 milligrams, there's studies about that at 100 milligrams twice a day of doxycycline, it's an inhibitory dose, it's not a killing dose. But for many people, you inhibit the bug and the immune system takes care of it. But in many people it doesn't do that, and the doxycycline may drive the bug into hiding, because that's another one. These bugs are very smart. You know, they're genetically very, very smart. And it's not like a strep throat. And there's, you know, plenty of evidence that they can adapt, they can adjust, they can hide, and it makes it just very difficult. So, you know, why do 3 weeks not often don't kill the bug? Well, it is an adaptive bug. You know, there's actually something in a bacteria, there's something called plasmids. And plasmids is DNA outside of the chromosomes. And plasmids are thought to give bacteria a defense against hostility, be it immune system or antibiotics. You know, the Lyme bacteria they found 21 of those. And the next bacteria in line has 7. So, you know, if a strep throat is like a guy with a gun, Lyme is like a stealth bomb.
And it's Borrelia that has the 21 plasmids?
What did you say?
Is it Borrelia that has?
Borrelia burgdorferi. Yeah. You know, and Lyme has the ability to suppress your immune system's reaction to itself. And so, when we do testing for Lyme, we really don't measure the bug itself. We measure the body's response to it, the body's defense against it. And I sometimes tell people when they come in and they have symptoms that are chronic, and then I find one band to be positive, but it's Lyme specific, but it doesn't meet the criteria, and they might have been told, oh no, you don't have it because you don't meet the criteria, but they have symptoms. I often treat them and then they get better. You know, and so, to use an analogy, so if I say I attack you and you don't defend yourself, does that mean I'm not attacking you? I mean, this is kind of an instance. We measure the body's defense, not the bug itself. And it's both ways. Sometimes people have a bug in their body and it doesn't make them sick. Now they're testing that you could do as you measure the DNA of the bug, but they seem to have the DNA present, but they're not sick. Yeah, that can be too. So it's a very complex issue. You know, the bacteria, the Lyme bacteria, can change from one form in another. Cell wall containing, cell wall deficient. It can form a cyst that the immune system can't recognize it. And then something that is a lot of talk in the last couple of years, or maybe even 10 years, is that these bacteria, they can form gooey stuff around themselves. They have these colonies and they form gooey stuff around themselves called biofilm. And it makes them very hard to penetrate by antibiotics or even natural substances. Now dentists know about biofilm. Now when you don't brush your teeth for 2 days, and you do like that, what's on your teeth is biofilm. Gooey stuff with bacteria in it. And sometimes you have to mechanically remove them by flossing and brushing hard. Now they found biofilm throughout the body, and not all biofilm is bad, but many of them are, and it makes it sometimes very hard to penetrate. And what happens sometimes when people get treated, then 95% of the bugs get killed and you feel better, and then 5% hides out in these biofilms, and then at some other convenient time in the future, sometimes suddenly these symptoms start coming back, and you know, while it looked like you were over it, but then for some reason the immune system goes down and then these bugs pop up. So can you overcome chronic Lyme disease with antibiotics only? I mean, you may and you may not. My opinion is that you cannot, but it doesn't mean they're not useful. I mean, recently there's some doctors, integrative alternative doctors and Lyme doctors have worked on very intense programs with 3-4 antibiotics at the same time. One including dapsone, which is an old TB drug, and various other, and they seem to have had results with people where nothing else was working. But you know, these are some very intense antibiotic protocols. This was a paper from the university I went to in Nijmegen in the Netherlands, and they did again some silly thing where they gave antibiotics for a month or 2 months, and then they say, oh, it doesn't cure chronic Lyme disease, long-term antibiotics are not useful. You know, when you see what they did, you could know up front that it wasn't going to show anything. It's just much more complex than that. So, you know, in my opinion, no, but I do use antibiotics and they're very useful. You know, it's kind of amazing when I see that. I see people have been sick for years and years and years, and then you find Lyme, and then you treat them for 2-3 months and it's better. And other people have been sick for 3 months and it takes them an enormous time to get better. It's so individual. And that's why, in a way, you have to kind of get away from saying, oh, it's the bug that made me all sick. And that you say, my body is not well, my body is sick, and these bugs are one part of it. You know, because in the end, it's always an interaction. It's not always about the bug, it's about the bug interacting with your body. You know, and the simple experience that many of you have had is that, you know, there are times when, everybody around you gets sick, and you just know you're not going to get sick because you feel great. And there are other times where you feel like everything comes by a cat. Because I feel weak and drained, and so that has to do with the condition of your body. So it all depends on your immune system. So what do I mean by that? So we talked already about Lyme and the co-infection. There's often many bugs. Diet, huge. Most people that come here, if they don't eat well or they change their diet, they can't get better. Many people, and of course many of these people are sick. They don't feel like cooking food. We are used to the American diet, a lot of refined carbs, junk foods, etc. But this is an extremely important thing. That's a picture of some of the, junk we're eating, and in one way it's really not food. I mean, indeed, of course, eating that way is not only a problem with Lyme disease; it's a problem with all diseases. I think even something like 70% of all chronic diseases, including cancer and heart disease, are related to whatnot. And in one way, we want to think, oh, it's the bug making me sick. And in the meantime, you're eating bad food. And that is often the hardest thing for us to do here in the office, is that, people don't mind taking antibiotics and getting infusions and injections and taking pills, but changing the diet is often a very, very difficult thing.
You're not going to do that.
Huh?
You're not going to do that.
No, don't talk about that. And, food sensitivities, I found a lot of people that often come and they seen other doctors and have been treated for Lyme disease, and they get better, but they never get, and then they come to me, and I do food sensitivity testing, and I do some hormonal testing, which I'll talk about in a minute, and then you support their adrenals, you cut some foods out, and suddenly, poof, they start getting better. Yeah? Toxins and chemicals, many times people with Lyme, they have trouble detoxifying, we get exposed to all these chemicals and toxins. And I have to say, before I even go further, I'm not trying to overwhelm you. When a person comes to a doctor like me or another integrated, it's my job to figure out where to focus on and to not overwhelm a person. Many times people, they get so overwhelmed, and not everything makes sense to them, and you can't make all these changes. So it's really the job of the doctor or the practitioner, whoever you see, to figure out where you can go and what you're able and willing to do. Because if you as a physician ask people to do things they can't do, you're going to make them worse. But if you ask them too little, then nothing happens either. So it's a matter of finding that. And so we do here in the office, we do great work with the staff, Angela, Marianne, and Dottie. We work a lot in helping people carry out what we want to do. It's very important. So, there's all these chemicals, toxins. I don't really want to focus much on that. It's amazing how you see just from getting up in the morning till you go to bed how many chemicals you get exposed to. And we don't really know what they're all doing. Yeah? Especially not when they come together on individual bodies. This was interesting in one paper there. In 2004, the CDC tested 2,500 people's blood and found traces of 116 chemicals in their blood. The second study is actually from the Netherlands. They found a cocktail of 287 industrial chemicals and pollutants in fetal cord blood of 10 infants. It's got to go. It's in the body. So it's just it's not that we want to become paranoid, but as we work with people, you become aware, and little by little you change. You choose a little different product. You change that a little bit and here a little bit, and slowly as you learn, you can change. So it doesn't, because when you look at these things all together, you get so, well, forget that, I'd rather die earlier than have to change all of that. But we have so many things available nowadays, especially in this area. There's good organic food, there are a lot of natural products, and you just start working with them. So, stress. It's a double-edged sword. People who are chronically ill are stressed because they're chronically ill. And so when you're chronically ill, everything used to be fun suddenly stresses you out. And it's huge. And I find often that when people come to me and they've been chronically ill, and then you find out they have Lyme and other things going on, that in the end, it's not about getting better and going to the life back you had. You know, life